Hello guys, my name is Ajara. I am a student of International Relations and it is a subject of political and economic processes in the world. And today we are going to overview an international humanitarian law. So in that presentation you are going to find answers to the following questions. What is international humanitarian law? What does IHL cover? Contemporary challenges for IHL, COVID-19 and IHL, and 5 things to remember about international humanitarian law. So let's start. International humanitarian law is the law of armed conflicts. It actually protects people who are not longer or not participating in the hostilities. It also restricts the means and methods of warfare. It is contained in different conventions and treaties, such as in the 4th Geneva Convention of 1949, the 1954 Convention for the Protection of Cultural Property, the 1972 Biological Weapons Convention, the 1993 Chemical Weapons Convention, and different additional protocols. International humanitarian law covers 2 areas. The first one is to protect those who are not longer taking part in the fighting, and second, it restricts the means and methods of warfare, in particular weapons, such as military tactics. International humanitarian law applies differently between international armed conflicts and non-international armed conflicts. International armed conflicts are those in which at least 2 states are involved. They are subject to the 4th Geneva Convention and Additional Protocol 1. Non-international armed conflicts are those restricted to the territory of a single state. They are laid down in Article 3 common to the 4th Geneva Convention, as well as in Additional Protocol 2. Treaties and customary international law are the 2 main sources of international humanitarian law rules and regulations. In addition, the International Committee of the Red Cross has International Humanitarian Law page that provides a number of introductory international humanitarian law resources. Nowadays, during the pandemic of COVID-19, international humanitarian law works even more than at basic usual days. For people living in war-torn countries, international humanitarian law provides crucial safeguards, especially during the pandemic. Adequately staffed and well-equipped medical facilities are necessary for the provision of medical care on a large scale, as demonstrated by the outbreak of COVID-19. Under international humanitarian law, medical personnel, units, and transfers exclusively assigned to medical purposes must be respected and protected in all circumstances. In occupied territories, the occupying power state must ensure and maintain medical and hospital establishments, as well as services, public health, and hygiene. In addition, international humanitarian law provides for the possibility of setting up hospital zones that may be dedicated to the current crises. Water supply facilities are of critical importance during the current crisis. In armed conflict situations, many of these installations have been destroyed by fighting over the years. Any disruption to their functioning means thousands of civilians would no longer be able to implement the basic prevention measures such as frequent hand washing, which can lead to the further spread of the virus. International humanitarian law prohibits attacking, destroying, or removing useless objects indispensable to the survival of the civilian population, including drinking water installations and supplies. Moreover, in the conduct of military operations, constant care must be taken to spare civilian objects, including water supply networks and installations. Many schools have been temporarily closed to prevent further spreading of COVID-19. The disruption of education has long-term effects. International humanitarian law contains rules that require parties to conflict to facilitate their access to education. The state and parties to conflict must ensure measures that the education is not interrupted and that children can learn from home. While an important preventive measure, this places education continuity under additional strain in contexts where education may already have been disrupted by armed conflicts. Detainees. Detention facilities are often overcrowded, have poor hygiene and lack of ventilation. It poses a grave challenge to the prevention of COVID-19. Under international humanitarian law, detainees' health and hygiene must be safeguarded, and sick detainees must receive the medical care and attention required by their condition. In the current situation, new arrivals should be tested for the virus, and hygiene measures should be increased in order to prevent the spread of disease. Internally displaced people, migrants, asylum seekers, and refugees are at the big risk of COVID-19 due to their harsh living conditions and limited access to the basic services including healthcare. Displaced civilians are entitled to shelter, hygiene, health, safety, and nutrition. International humanitarian law protects all civilians against the effects of armed hostilities and against arbitrary deprivation of liberty, and it also provides for their access to health care without discrimination. The current COVID-19 crisis requires the mobilization of significant humanitarian resources that are often lacking in countries affected by armed conflicts. Sanctions and other restrictive measures can impede impartial humanitarian action in these areas. They may also hinder impartial humanitarian organizations from carrying out their exclusively humanitarian activities in a principled manner. States and international organizations enforcing such measures should make sure that they are consistent with international humanitarian law. They should devise effective mitigation measures such as humanitarian exemptions benefiting impartial humanitarian organizations. There are contemporary challenges for international humanitarian law due to the reason that new technologies has entered the modern battlefield. Cyberspace has opened up a new warfighting domain. Remote-controlled weapons such as drones are increasingly being used by the parties to the armed conflicts. Automated robots are also considered to be used in the future on the battlefield. There can be no doubt that international humanitarian law applies to these new weapons and the employment of new technology in warfare. That's why these new methods of warfare pose legal and practical challenges in terms of ensuring their use with existing international humanitarian law norms. In order to conclude my presentation, I would like to give you 5 things that you need to remember about international humanitarian law. First, international humanitarian law applies only during armed conflicts. Second, international humanitarian law does not decide on the legality of a conflict. Third, international humanitarian law is based on a balance between humanitarian and military considerations. Fourth, international humanitarian law does not prohibit all violence. And the last one, the central modern conventions of international humanitarian law are the Geneva Conventions of 1949. That is the end of my presentation. I hope that you learned something from it. Thank you so much for being with me, and if you'd like to learn more about international humanitarian law, you can visit these websites and learn by yourself. Goodbye!